When I was a fourth-year medical student, I was doing a rotation in emergency medicine, and it was my second rotation at this particular hospital with that group of emergency physicians. And I was scheduled to work the nights, and it was one of my last shifts of my rotation. And I was coming in at 8 p.m. to start the night shift, and I would be leaving at 8 a.m. And I came on to shift, and the doctor that was working the afternoon shift, he was going to be leaving at 11 o'clock p.m. And so I had about a 3-hour overlap, and he was the head of the emergency department. And early on in my shift, towards the end of his shift, we had a code blue come in. Basically, a lady in her 40s had gone into cardiac arrest, and her children found her and were doing CPR. They brought her in, and we were doing compressions and shocks and everything that you can think of from the pit in the emergency room for a period of about 40 minutes, and it was not going well. We were waiting until this lady's husband could arrive at the emergency room because we didn't want to quit trying, obviously, until the whole family was there. And so when that happened, after 55, 60 minutes of performing CPR, and it became obvious that this individual was not going to recover from the cardiac arrest, efforts to save her life were ended, and I went with that emergency physician and watched him speak to the family. And the level of professionalism and compassion and care that he delivered that news to the family has left a lasting impression on me. I take that kind of information and that example when I have to call patients and tell them that they have a melanoma that could be life-threatening. But it wasn't just that in this particular story. I had developed a good relationship with this particular doctor, and he knew that this whole experience is a difficult thing for a medical student to go through because we are not used to seeing people in that state dying and delivering bad news. And he did something that not every doctor would do, but it's something that I really appreciated. When the evening doctor came on at about 10:30 to start the transition so that my attending that I was working with could leave the hospital, he told him that I'd been there all day with him and that I was going to be leaving when he left. And that was a surprise to the doctor. He thought I was going to be there all night, and I was supposed to be there all night. However, this was news to me. I didn't ask to leave. I was ready to buckle down and complete my shift. But he told me he'd like me to come out and grab a bite to eat with him and the PA that he'd been working with. And they took me out and just taught me about compassion in medicine and wanted to make sure I was okay after seeing something like that. And that impressed a great deal upon me about the kind of people that we have working in the medical system. Everybody is so frustrated with medicine because healthcare costs are out of this world. And when it comes right down to it, the doctors and the nurses that are showing up every day to deliver the care that our patients need, that's what I see in medicine. These are the people that really care. And we're just as frustrated as you about the cost of healthcare and the political divides that are going on, and health insurance companies and pharmacy benefit managers and all of these other outside organizations that make it more difficult for you to access care. But at the end of the day, having trained in medicine, having worked with many doctors, and seeing the example of this particular doctor, there are good people out there who really are there to help you, and they're training up a new generation of physicians to do the same thing. This particular doctor is named Dr. John Parente. He's an emergency medicine physician, and he is on social media, and I would encourage you guys to give him a follow on TikTok, Instagram, Facebook, wherever you like to consume social media at, because he is somebody that has remained a friend long after I've completed my medical training. And he's always been a good example to me of care and compassion in medicine. He's entertaining as heck. He's a fun guy to be around, and he deserves a follow from you. And I wanted to let you know what kind of person he is and the way that I see doctors and nurses working hard in medicine every single day.